Carmex has been soothing lips for almost 80 years. And now our latest innovation, Carmex Cold Sore Treatment, blocks pain and itch on contact while it smooths and fills for a less visible sore. Try Carmex Cold Sore Treatment, voted Product of the Year. And for dry, chapped lips, try Carmex Lip Balms.
Hi, I'm Rob Eder, and this is Drugstore News TV. Today, we're here in Deerfield, Illinois, home of Walgreens corporate headquarters. Walgreens, of course, the subject of our September cover story, Enabling Patient Care. Today, I'm joined by President of Pharmacy and Retail Operations, Richard Ashworth. And Richard's going to talk to us a little bit about Walgreens' vision to help reinvent healthcare. Richard, welcome to the program.
Oh, thank you for having me.
Richard, in our September issue, you noted that Walgreens is moving into something you're calling a collaborative services model. Can you talk to us a little bit about what that means, what the model looks like, and how it's helping Walgreens create innovative programs like well transitions, for instance?
Yeah, for sure. I mean, the basic premise is quite simple. It's taking the best of what we have, capabilities in the marketplace as it relates to pharmacy and healthcare, and then putting that together with the best of what others have in the market for what they do for patient care. And when we say collaborative services, it's putting things together in a way that ultimately is better for patients and lowers the cost and raises their health outcomes. One example of that, as you mentioned, is well transitions. That's a great example because this is where we work in partnership and collaboration with the health system to work on the discharge planning process. So when people leave, they already have the prescriptions that they need without having to stop by even one of our stores or many other drugstores in the marketplace and can go straight home. And so this addresses the primary non-adherence gap as just one example. It's a multi-billion-dollar problem in our healthcare system, and this is just one example of a collaborative services agreement that we've got with health systems.
Richard, you noted that these partnerships with local health systems are just one of the strategic pillars of Walgreens' healthcare strategy. Can you talk to us a little bit about the other strategic pillars and perhaps how they come together?
Yeah. And the first pillar is about accessibility for patients. So we've got, the 8,300 drugstores. We're, in all 50 states. We've got quite a good locational advantage for sure. And then on the contracting side, just making certain we're working in partnership with our pharmacy benefit management partners and others to make certain that Walgreens can take care of patients. It's about then, the next pillar is really about expansion of services, ones we do on our own, and then ones, as you mentioned, like in a collaborative services way. And we think about those quite distinctly. So things we do in our retail stores and things we might be doing outside of our retail stores. And lastly, it's really about service. So it's about the experience that patients are having and the relationship with their local pharmacist and working on ways to maximize that relationship to make it better for patients and also to make it better for us.
Richard, the Walgreens loyalty card program, Balance Rewards, was originally launched with an idea that it could be used to incentivize customers to make healthier choices. But a new partnership you have with WebMD is really kind of activating that and taking it to a new level. Can you talk to us a little bit about the WebMD partnership, how it works, and maybe what you're hoping to accomplish?
Yeah, for sure. I mean, that's a great partnership. So what it really is, it's an evolution of what we started. So as a base platform, it was how do we activate and incentivize people to make good purchases and to have good behavior, whether it be activity and running and the food choices they make, et cetera. And Balance Rewards for Healthy Choices was a great foundation for that. Our relationship with WebMD is just an extension of that. It's putting together a fantastic brand in WebMD and all of the patients and customers that they help with. And it created a digital advising campaign, really, a platform by which our pharmacists can engage with patients in collaboration with WebMD. So it's one, taking all of the access to patients that we have and they have and putting it together in that platform, but it's curating it locally so that you have pharmacists who can engage in the platform.
Richard, another area where Walgreens has really been a leader and an early adopter has been in the retail clinic space. Recently, you announced a new partnership in the Pacific Northwest. And although you have a lot of clinical partnerships and affiliations on the retail clinic side, this one's a little bit different in terms of how you'll develop and staff the clinics. Can you talk to us a little bit about your partnership with Providence and how it's going to help you evolve the retail clinic model?
Well, the first thing I'll say is that it's going to look different all across the U.S. health systems are very unique and different, and they have different ways of approaching it, and we have to be agile and flex to that as well. Providence example is a fantastic one where the teams got together and really worked out in that market. How does Providence want to approach the market, and how is Walgreens comfortable with approaching the market? And we came with a very aligned view in the Pacific Northwest about how we do that. And in this case, they'll be running the clinics. Their EMR will be doing the administrative components of it, and care will be delivered by their nurse practitioners. We'll have our pharmacies wrapped around it, and our pharmacists will be doing those pharmacy services as well for that patient population. This allows a seamless connection within their system there, and I think that's going to be positive for patients. We still have all of our own nurse practitioner-run clinics. We're going to continue on with those as well. And I suspect that you'll see different manifestations of this across the U.S. as we continue to grow the model. For us, the whole thing is based on partnership.
One other area where Walgreens is showing its innovation, Richard, is in telemedicine. You have an interesting partnership with MD Live that's helping expand access to care. Can you talk to us a little bit about that partnership and how it works and how it's going to fit in maybe on the pharmacy and on the clinic side?
So partnership with MD Live, another partnership, as you say, but it's very positive for us. And so it's integrated into our retail app. We have one of the most downloaded apps in the U.S. and a lot of activity that is being used through the Walgreens app. And MD Live is no exception to that. We're in 20 states right now. We've got a good opportunity here. This isn't for every patient. This is for a subset of patients who have their mobile device and need an acute episodic conversation with a clinician. And again, if you think about a partnership model locally, we can manifest those physicians with that health system through the MD Live network as well. Or there's many different ways to do this. That's kind of the outer ring, if you will, of our telehealth strategy. The second is and we're still evaluating the right options, but looking at some type of limited diagnostic capabilities in stores. So we can use Theranos, as we previously talked about, for some of the laboratory and diagnostic views, but there's also, other companies out there that are doing good, kiosk-type technology where you can get access to the physician, but also do some limited diagnostics. Then you have our retail clinics, whether it be in a partnership collaborative services agreement like with Providence, or if it's one of our own where we can do an expanded set as well. So I feel like there's multiple ways by which you can enter into getting healthcare at Walgreens.
Richard, in our September issue, you described your specialty pharmacy business as an integrated multi-channel specialty model. Talk to us about what that means and how is it helping to improve patient access to specialty medications?
Yeah, the main thing for us is that accessibility. I mentioned that as one of the pillars, and that applies to our specialty business as well. So we have a core central specialty capability, which is very standard in the industry of how specialty is delivered. So mail order technology, having a centralized repository of clinical data and programs, et cetera. And we work with pharma and with payers to do that. And that's quite successful. We're very good at it. But the reason we say integrated multi-channel is that we really manifest the majority of our specialty locally. We can do that through our retail stores, but in most capacity, it's actually done through our health system pharmacies. So we've got a couple hundred of those where they sit on health system campuses. We also have about 1,000 other pharmacies that are what we call specialized pharmacies, where our pharmacists are given extra education, where the access to medicines from a limited distribution capability are advantaged in these locations. And this is where we treat folks that have these, rare and chronic diseases, these high-cost diseases that our pharmacists are ready to engage and deliver. What we like about this is that it sits at our care model, which is one of our other pillars. And this is where our pharmacists can be live, face-to-face with these specialty patients.
Richard, last question. What would you say is your biggest challenge, and what advice would you have for vendors, for pharma companies, tech companies, other companies that might look to partner with Walgreens? What are you looking for? What is Walgreens looking for in a strategic partnership?
It's very simple for us. So we want someone who is focused on the patient. So we put the patient at the center of everything that we do. And as we're creating new molecules, or if we're creating new distribution channels or new marketing materials, whatever they may be, having that inpatient in mind will make it easier to partner with Walgreens, because that's where our end focus is making certain that at the end of the day we have fantastic R&D and great products, but if patients don't take them, then it won't do any of us any good. And if our pharmacists can't deliver it the right way and ensure that they have the right information, they won't take it, and it won't do anybody any good. So for us, It's about putting the patient at the center of everything that we do. And you'll notice that when you talk to us about, new partnerships.
Richard, thanks very much for your time this afternoon. I'm Rob Eder. He's Richard Ashworth. Keep watching Drugstore News TV.